Welcome back to yet another episode of Rethink Healthcare. I'm one of your hosts, Wendy Ball, and this is
Mr. Paul Montenegro once again.
Woo! I don't know why you get all the cheers.
We've talked about this before.
I know. Maybe if you introduce, I'll get the cheers.
Welcome, Miss Wendy Ball.
Woo! The crowd goes wild.
Look at that. Anyway, did you notice the previous episodes we've had with the questions? A lot of students are really kind of chiming in on those.
I know, digging into those questions.
So we're gonna kind of feed more of that since students seem to really enjoy that, and we did have requests to keep doing more. So the question I prepared the question for today, and I chose one of the topics that, for me, what I thought was harder as a student. Mm-hmm. Was there a specific specialty or topic that was hard for you as a student?
No, I was just great at all of them. No, I'm kidding. What areas? I mean, I always say like neuro.
Neuro?
Yeah.
Actually, I was okay with neuro. I actually worked in
I was okay, but it wasn't my favorite.
I mean, I worked in a neurotrauma ICU at one point.
Well, then
so I was okay with neuro.
Yeah.
So the topic I chose was psych. How are you in psych?
I was good.
Well, you must have dealt quite a bit with, in the emergency department. I mean, that's one of the triages that you have to do.
I always tell my students that, obviously we're dealing with our patients holistically and we're looking at them as a whole being. So we are dealing with not just their physical, but all of our patients' mental health.
Yes.
Even if they're not there for mental health reasons. So many patients deal with depression, anxiety, those type of things, in addition to whatever they're there maybe for in a physical health way, because we know that makes us anxious, right? When we're in the hospital or maybe depressed that we can't be with our family. Dealing with crisis patients or mental health patients, I think does take a special nurse.
Yes.
So if that's you out there or that's your heart's desire to work with that population, we need that. So
see, here's why I felt like, for me, right, where psychiatry was a bit more tougher, is because I like to be able to measure things. So you know how when we're measuring, looking at laboratory values, looking at blood pressure, you're actually measuring something, you do an intervention, and then
it's getting better or getting worse.
But in psychiatry, things somehow get to be a bit more qualitative. And with that, it's I have a hard time wrapping myself around this. And it's like, how do you put a scale into someone's psychosis?
A little more subjective of how the patient's doing. Yeah.
So anyway, well, let's dive into the question here, right?
Okay.
So you want me to read it?
I'm gonna read it.
Okay.
So we have the LPN LVN on duty is treating a patient who describes her mission in life as a savior for her son by eliminating the sluts of the world.
That's quite harsh.
That is. There are several attractive young women in the unit. What should the nurse do first? So let's have our options here and see what we're going to do first.
Before we even look at the options, right? The question is telling you basically priority. What do you do first? There's a chance the answers are going to tell you that you should do them all.
You should do them all.
There's a chance, right?
They might be all good choices, but what
do you do first? Yes.
What is number one?
Okay.
So we have asked the patient to discuss her concerns in the next group therapy session.
That's important.
That is important.
Yeah, that's part of therapy.
Yeah. The next answer is ask the patient to discuss her feelings and mission with the people she is referring to.
Yeah, that's kind of part of catharsis per se, So, okay.
Ask the patient for the definition of eliminating.
Ooh, that's a good one.
Yeah, we might have to go back and read the question on that one and see what that's referring to. And inform the females in the unit to dress in long pants.
I don't think that's...
Sometimes there is an obvious one.
Yeah, that's an odd one. I think we definitely throw that one out. But definitely 1, 2, and 3 have utmost importance there. Related to the case. So let's Let's look at the first one, right? So, group therapy.
Okay.
Let's phrase it back to what should the nurse do first?
Maslow's hierarchy.
Is group therapy going to be considered a first line intervention?
You're probably not going to get into that group that day.
That's
right?
true, yeah.
Right, so we could just go there on a time period.
Yeah.
It might take some time to figure out what group to, maybe
What's
it's not meeting
appropriate?
till Thursday.
Exactly.
And today's Monday.
So, yes, so I would definitely take that one kind of not high priority because remember, it's asking you what should you do first.
I think it's a good thing to do and a good thing to talk about. But
Yes.
maybe not first.
Second one, right? Second choice you had is
Number 2.
ask the patient to discuss her feelings and mission with the people she is referring to.
That could be.
That's kind of deep.
That could be. It depends on the people too, because you don't want to just come up to somebody and say, you know what, I feel like you're a slut. That might not go over well.
Yeah.
But
And
maybe
and,
there is appropriate ways to do that too.
And it's also referring to looks like multiple people. So is a multiple person intervention usually a first line, especially in psychiatry? I mean, 'cause that's a process. So no, I wouldn't think that, right? Now the other one.
So then we're definitely doing inform all the females on the unit to wear long pants. No.
Can you really do that though? Can you tell somebody you
I'm
have
just
to wear
kidding,
it? No,
Paul.
I don't think so.
I'm kidding.
As a male nurse, I don't think it's appropriate to be telling what females should be wearing. Yeah, so I mean, you have to dress professionally,
Yes.
but
I mean,
that's the
sometimes
standard. Yeah.
I have had some patients walking down the hallway without pants on. I have had to tell them, you got to wear something down there.
Yes.
Right?
I agree,
So,
but they're the patient.
Yes, that's true. Well, if the family came in and was not wearing pants either or anything, I might have to have a little discussion with them.
Right.
So, but that's not what we're talking about here.
So how about the option of ask the patient for the definition of eliminating?
I think that, so let's go back to the question. So she said it's her mission in life as a savior for her son by eliminating the sluts of this world. So what does eliminating mean to her?
I mean, to me, by putting things in perspective there, I mean, it could be a threat.
It could be a threat. So is she homicidal? Does she want to?
We don't know, because when you want to eliminate something, right? I mean, elimination could just be going to the bathroom, you know, but in this case, she looks like she's trying to have vengeance for her son. So if you put it all in context, right, eliminating could be a threat.
So safety is high up there on priority.
Yes,
We want to make sure.
What should the psychiatric nurse do first is spot any potential threats to the patient itself and people around them.
Yes.
So, including yourself.
Yes, absolutely.
So,
yes.
Yeah.
Yes.
So I think the proper answer there would be ask him to define, because by that way you're not directly confronting them to say, are you going to harm people, right? But then you're asking, can you tell me, what do we want in psychiatry? You wanted to talk. The ideal is catharsis, right? You're kind of prodding the question of, what do you mean when you said that?
I think asking questions is a great way to elicit what the patient's feeling, kind of getting that deeper understanding of things. So if the patient comes back and just says, I am hopeful that everybody will start wearing, jackets and snow pants, right? Then maybe they don't want to eliminate in the way. But if they're like, I'm going to take them out, then we need to then, notify whoever.
Notify and really put them on notice to put the staff on notice that, hey, we may have somebody here who could potentially cause harm.
And then follow whatever procedures your facility has, whether it's you need to contact the police department and follow up on that, because safety is utmost concern after, our ABCs and those type of things. So I think you are correct. I think the answer is that. Sounds good. So that was a tough one. I know that was a little tough, because you can get kind of confused and kind of like, ooh, but that would be great for them to talk about their feelings. And that is true. But looking at the question by what is first is most important. How about if they wanted to do more questions?
Who wanted to do more questions?
Our viewers out there.
So, on the next episode, why don't we do another set
Okay, I think that's great.
Right.
We're going to do more questions. So
we'll see you at our next episode.
look for the next one. We'll see you later.